Hello and welcome to the ACE-IT podcast, where we turn science into sense. This is the lucky 13th season of ACE-IT, and we could not be more proud to deliver the rich scientific content to you in a usable and understandable way. ACE-IT is brought to you via the Justice Community Overdose Innovation Network, or JCOIN. If you're new to ACE-IT, welcome, and check out the prior seasons to begin or continue your learning journey. We are exceptionally grateful for every listener, and we promise we will continue working to help you learn and never let you down. Also, a quick plug for a few other JCOIN features. Did you know that you can get technical assistance for your organization from the experts at JCOIN? And did you know you can apply for small research grants to help fund an innovative study idea? Yep, also through JCOIN. And did you know you can apply to be a JCOIN Leap Scholar or investigator to improve your own skills? Also through JCOIN. If any or all of these exciting offerings sound interesting to you, check out our website, www.jcoin-ctc.org, and learn about the many JCOIN offerings beyond ACE-IT that may help you learn and grow in ways that improve lives, including your own. With that, I'm honored that you're with us. I'm Danielle Rudes, your host, and this is ACE-IT. Welcome back to Season 13 of the ACE-IT podcast, Evolving Responses to Opioid Use Disorder and Overdose. In this season, we're examining the shift in prevention, treatment, and recovery strategies in response to the ongoing opioid and overdose crises in the United States and beyond. From emerging clinical approaches to peer-led efforts, we're highlighting the many ways individuals and systems are adapting to save lives and support recovery. Today, we are diving into the world of outpatient counseling and overdose responses. This is part of the opioid crisis that doesn't always make the headlines, but shapes thousands of lives every day. When we think about addiction treatment, people often imagine inpatient rehab or emergency interventions. But for most people living with opioid use disorder, recovery actually happens outside of hospital walls, in community clinics, counseling centers, and through outreach programs that meet people where they are. These outpatient services are where science, compassion, and persistence meet. They connect people to medications, therapy, and social support. But as research shows, they're not always reaching their full potential. So we'll explore what makes outpatient programs work, where they fall short, and how communities are rethinking recovery to save lives and restore hope. Outpatient counseling programs are often the first line of defense for people seeking help with substance use disorder, including opioid use disorders. But here's the challenge. When outpatient counseling is essential, and it is, many programs are missing a key ingredient: medication. Using national survey data, a study conducted by Bush and colleagues 2025 found that only about half of outpatient programs offer medication for opioid use disorder, and even fewer offer medications for alcohol use disorder. Another study by Koliwala and colleagues 2019 found that fewer than 10% of people who survived a non-fatal opioid overdose went on to receive medications for opioid use disorder. These medications, as we discussed a bit more in previous episodes, are proven to reduce cravings, prevent relapse, and lower the risk of overdose. Outpatient clinics also face another often overlooked challenge: being prepared for overdose emergencies. Many clinics treat OUD regularly. They encounter overdoses. Yet, there is surprisingly little research or formal guidance on how to handle these life-threatening situations. A recent review by Goldstein and Grubb 2025 identified 4 key strategies. 1. Simulation training for emergency response. 2. Clearly defined team roles. 3. Readiness of equipment like naloxone. And 4. Written action protocols that are practiced and updated regularly. Most of that research, though, comes from pediatrics or dentistry, not addiction treatment. These challenges reveal a huge gap in care, but a chance for outpatient programs to make a difference by working on creating tailored, evidence-based overdose response models, as well as offering both counseling and medications while coordinating with hospitals and community resources. They can strengthen the bridge between crisis and care. This could help ensure the people who experience and survive an overdose don't fall through the cracks, but instead find their way to lasting care. Building on that, let's look at what happens when communities don't wait for people to come to treatment, when they go out and find them. Across the United States, community-based post-overdose outreach programs are reaching out directly to people who've recently overdosed, often within days, sometimes at their home, sometimes on the street. Their mission is simple: to connect people to care. A study conducted by Bailey and colleagues 2023 highlights some of the excellent work of the multidisciplinary teams. These teams are made up of healthcare professionals, peer recovery coaches, and sometimes law enforcement, offering a broad range of services. They can hand out referrals to outpatient counseling, offer recovery coaching, give resources for housing and employment, and even provide naloxone distribution. Two powerful examples discussed in another study by Way and colleagues 2019 were programs such as Anchored and Anchor More. Both started in Rhode Island and used certified peer recovery specialists to bridge the gap between overdose and treatment. In emergency departments, these peers met with patients after an overdose, offering naloxone training and overdose prevention education. Nearly 89% of patients receiving naloxone training and 87% agreed to continue outreach after leaving the hospital. That is an incredible number. Those are incredible engagement rates. Outside the hospital, they conducted street outreach in high-risk areas, distributing the same resources, as well as connecting people to outpatient or inpatient treatment and social services. About half of individuals that they engaged with accepted referrals to outpatient programs, including counseling, medication-assisted therapy, and ongoing peer support. Continuing engagement is crucial. These peers can help clients build recovery capital, meaning the health, wellness, and stability needed to sustain recovery success. Programs like this show what's possible when harm reduction, peer recovery, and outpatient counseling work together. To further understand how outpatient and harm reduction programs really work, we also need to hear what people who are living and working inside of these programs have to say. One study conducted by Nyashanu and colleagues 2023 explored the experiences of both clients and peer outreach workers in an outpatient opioid substitution therapy program, offering some important perceptions. Clients in this study overwhelmingly supported harm reduction and opioid substitution therapy, describing it as a lifeline after failed attempts at abstinence-only rehab. They said that the program gave them renewed hope and stability, but accessibility remained a major issue. Too few clinics, too few slots, too much stigma. Peer outreach workers also pointed to another challenge: community misconceptions about harm reduction. Many people still misunderstood or judge medication-based recovery, which keeps others from seeking help. Meanwhile, another study by Scott and colleagues 2020 discussed the REMO pilot project. REMO stands for Recovery, Initiation, and Management After Overdose. This is a unique way to keep clients engaged in care. Instead of simply giving referrals, REMO teams used assertive outreach, regular follow-ups, motivational interviewing, and practical help with barriers like transportation or scheduling. Through this project, the results were dramatic. 81% of the participants started medication-assisted therapy compared with just 18% with a standard referral. See, the difference wasn't just about resources. It was also about persistence and care. Those who participated in REMO said staff stayed connected and genuinely cared, something many had never experienced before. When we look across all of these stories and all of these studies, from medication access to overdose preparedness to peer recovery and assertive outreach, it becomes clear that outpatient programs work best when they combine medical treatment with human connection. Medication-assisted therapies save lives. Harm reduction keeps people safe long enough to recover. Peer workers create trust where stigma once stood, and outreach ensures that care doesn't end when someone walks out the door. But to truly strengthen these programs, we need to go further in expanding access, adopting proactive outreach, and building the public's understanding to reduce stigma and support compassionate care. When these elements come together, outpatient programs do more than prevent death. They restore dignity. They build relationships. They give people the stability to imagine something beyond survival. Thank you for listening to the ACE-IT podcast. We love hearing from you. So if you have comments, topics to suggest, or some science you'd like us to cover in a future season, please write me. Danielle Rudes at Sam Houston State University in Texas. My email is drudes@shsu.edu. And of course, thank you to the Justice Community Overdose Innovation Network, or JCOIN's Coordination and Translation Center, funded by the National Institute on Drug Abuse, housed at George Mason University, where this podcast originated. Thank you to our fabulous and amazing scriptwriters, and also my fabulous and amazing doctoral students, Bryce Kushmarek-McCune, Jalen Magana, and Caitlin Bauer. And a huge and heartfelt thank you to the team at Slonky LLC for their wonderful production as always. Tune in again soon for another episode and even a whole nother season of ACE-IT.